Everybody come on in. This is E with the Pine Bluff commercial. I am here live at Jefferson Regional Medical Center where we are here commemorating the first day that COVID-19 hit Pine Bluff, Arkansas, our first COVID patient. This is Mr. Black. He was our first COVID-19 patient. And just thankful to be able to see him here. You know, a lot of people aren't able to, see their loved ones who may have suffered from this virus. So on this day, we're just kind of commemorating the 1 year and remembering when COVID-19 first hit Arkansas right here in Pine Bluff. Governor Asa Hutchinson just made his arrival.
A good crowd here today. How's everybody doing? Well, good afternoon, everyone. I'm Brian Thomas, President and CEO here at Jefferson Regional, and I'm so pleased that you're all here to help us share in this historic observance with us. On behalf of over 1,500 employees, over 200 medical staff members of Jefferson Regional, which most of which will be watching this via social media today, today is a day of reflection, honor, and certainly celebration of a year that will undoubtedly be etched in history with all of us. Today not only marks the date that the World Health Organization proclaimed the pandemic, but today also reflects the 1-year mark here at Jefferson Regional, as well as other Arkansas hospitals' fight against COVID-19. To help us celebrate and reflect this year, we're honored to have several very special guests with us today. Governor Hutchinson, I believe the mayor is here. I believe I saw Mayor, yes, there's Mayor Washington. Is Mr. Bo Ryle here? Excellent, good to see you, Bo. We're also honored to have several members of our personal team that are going to be able to share some of their experiences over this last 12 months. And we also have a very special guest that we'll introduce just a little bit later. 1 year ago today, we all came into work just like it was any other day. We had no idea how significant life was going to change over the next 24 hours, and certainly over the next many months. We all knew COVID-19 would eventually reach our hospital here in Pine Bluff, and we'd prepared as much as possible, like most hospitals across the nation, but we just never envisioned that this would be the first place that the COVID pandemic made its mark in our state. I remember that day like it was yesterday. I think my phone started ringing about 9 o'clock, and within an hour, we were on a call with the health department talking about all the details and confirming basically one of our patients had in fact contracted COVID-19 and was positive. Our incredible team did what they do best. They responded. Our leaders quickly assembled communication and coordination with the Department of Health, the governor's office, certainly the hospital association and many other constituents. And soon a number of policies were implemented and put in place on behalf of our patients and our visitors, and certainly our employees, to ensure a safe and secure environment was made. Despite a lot of uncertainty and certainly a lot of media attention, especially those first few days, our employees and medical staff did engage and did what they were trained to do, which is simply take care of patients. Remarkable response. Over the months, we had countless numbers of staff and physicians working long hours, certainly a lot of days a week, and ensuring our systems were in place to make sure that we were providing the absolute best care for our patients. Many actually worked a lot of long hours and extra shifts just to make sure that we were doing everything we could possibly do to ensure that we won the fight. Words can't express how personally I'm proud of all of our employees, our team members, and our physicians, those on the front line, and certainly all those in the support levels as well. This has been undoubtedly a great team effort here for our organization. Over this past year, Jefferson Regional has treated over 900 COVID inpatients here inside the facility, as well as 1,928 patients on the outpatient setting. Remarkable numbers. And throughout this year, 282 of our employees and physicians have contracted COVID-19. Over the past 12 months, we performed 21,000 COVID-19 tests, and those testing platforms are still very active today. Sadly, and despite a lot of extraordinary efforts, we have suffered experience of patient loss, and all told, 135 of our patients have lost the battle to COVID-19 while being treated here in the facility. As difficult as the journey has been, we certainly have a lot of success to share along the way, a lot of success stories. Our physicians have been truly remarkable along this journey, not just caring for patients on a day-to-day basis, but ensuring that our staff and our well-being is intact and that we are providing the very best of quality in our organization that we could ask for. I see her in the back, but Dr. Nazni Jamal, one of our hospitalists, has been our physician lead of our COVID response team with our medical group, and she has truly done an incredible job, and we are certainly proud of her and her accomplishments over this last year. Special thanks to several other physician leaders. Some are in the room. Our Chief of Staff, Dr. Amy Cahill, Chief Medical Officer, Dr. Reed Pierce, Medical Director, Dr. Charles Mabry, and a countless other physicians working on the front lines of the ICU. Dr. Al-Nashif, Dr. Mohammed, and Dr. Taylor have been putting in countless hours making sure over this we are providing the best of care for our patients. I can't say enough about the nurses and the bedside staff that have been taking care of patients at the bedside, and also all the support staff that have made this organization make its way through this. Speaking of which, like housekeeping, it's amazing how important even housekeeping and keeping a clean environment, especially during a pandemic, is to keeping a clean organization. But each and every day we witness certainly the heroic excellence and compassion from all of our staff, and their dedication gives us the fuel to continue moving forward. There is perhaps the brightest story that we've had is our patient number one, the very first COVID-19 patient in the state of Arkansas. This amazing individual spent many months here at our organization and then eventually transferred to a long-term care facility. And today I'm excited to tell you he is doing well and back to life. Ladies and gentlemen, please join me in honoring Mr. James Black, Arkansas's patient number one. We're so proud to have you here, you and your family. We appreciate you being here today. I know a lot of people have worked hard and dedicated a lot of hours over the last year, but our next speaker undoubtedly has worked harder than anyone else that I personally know here. In fact, I'm not sure that he had a day off the first 4, 5, 6 months, isn't that right? Today we're honored to have him graciously join us in recognizing the tremendous accomplishment and work not only here at our hospital at Jefferson Regional, but for all the healthcare institutions and support all the healthcare heroes across the state of what we've been doing in this last year. Please help me welcome Governor Asa Hutchinson.
Thank you, Brian, and that's right. I'm here for really one reason, and that is to commemorate this moment in history a year ago, but also to express thanks to those that have been on the front line here at Jefferson Regional Medical Center. And I'm proud of you. I haven't been able to be here day in and day out because you're busy doing your work, and I had a few responsibilities myself. But the whole state of Arkansas is grateful for not just what you've done in healing patients and ministering to people, but also how you've set the example for the state in terms of resilience, in terms of setting best practices, and help us to learn from day one to day 365. And the progress that's been made to a large extent is the result of the work that you've done here at this hospital. So please give yourself a round of applause. Thank you for what you've done. I also want to recognize Dr. Jose Romero, who's our Secretary of Health, I've worn out 2 secretaries during this time. Secretary Nate Smith was here at the very beginning a year ago, and then Dr. Romero has ably come in to provide assistance and lead the effort, and we're grateful for him. Mayor Washington, it is good to be in your city again. And James, is that right?
Yes, sir.
Well done. Well done. Now, I did get to meet you a year ago. I know that you've been through it, but thanks for being here and being, just by your living example, sharing a story of this last year. It means a lot to the people of Arkansas that you're willing to be here and commemorate this day. And really, I wanted to start just by a moment reflecting back on 20 years ago. Almost 20 years ago, the United States of America was attacked by terrorists. We lost almost 3,000 Americans during that time, and we called it our 9/11. Well, 1 year ago, we had our first case of COVID-19 here in the state of Arkansas, and it became our 3/11. And it was our challenge, it was our emergency. On that same day, I declared a public health emergency. We went to work, and we've been at work the last year. And during that time, we've lost 5,300 Arkansans to the coronavirus. But at the same time, we've seen the resilience of Arkansans. We've seen the magnitude of the capability of our pharmaceutical industry in being able to produce a vaccine that can cure people, or that can immunize people from this deadly disease. And that is the best of America, where we're number one in health, where we can put our researchers to work and say, we've got a problem, what's the solution? And you do it in record time. You get the solution through our scientists, our healthcare workers, and then you put it in production in warp speed. And the result is that today we have almost 17% of Arkansans with one dose of the vaccine. That is progress, that is the human spirit, that is the American spirit in action. And in Arkansas, we've seen that same resilience. We've seen that same leadership and that same commitment to our by our healthcare professionals. And I know I came here to honor you and to thank you, but I also want to take a moment to thank all of our healthcare professionals across the state of Arkansas. Bo Ryle leads the hospital effort, and those in the hospitals have done an incredible job. Those are frontline physicians and our respiratory specialists. They have had to fight the battle day in and day out, and through their work, they've developed better therapeutics and better management. And the result of that is the combination of the vaccine at work and the combination of better therapeutics means that today we drop below 300 in hospitalization statewide, and that is the lowest that we've had in probably 6 or 7 months. And so we're making progress, and yes, this is not a formal report, but I'll tell you that today's numbers are down, hospitalizations are down, and we're making continued progress in this fight against the virus. We want that day where the pandemic ends, and that day will come. And that day will come when we set the example for everyone to get the vaccine, for everyone to have that life-saving capability and protection that will save lives, and that is our goal. We've learned a lot during this time. We've learned to adapt, we've learned to innovate, and we've learned to fight through the challenges that we face. So with that, I express my thanks to you, and I want to end by noting that there is a sign of memory and a sign of hope for the future, and that is through the donation of the Forestry Division of our Arkansas Department of Agriculture is donating 10,000 oak saplings that you can pick up free of charge to plant in your yard or somewhere in memory of a lost loved one during this pandemic. And as setting the example, I talked to the First Lady, and the First Lady and I will be planting an oak seedling on the mansion grounds with a recognition of lives lost during this pandemic and the hope for the future that we all have. Thank you, and God bless you.
Thank you. I'm Bo Ryle, President and CEO of the Arkansas Hospital Association, and thank you to Brian Thomas and your team here at Jefferson Regional Medical Center for your reaction and care to the first COVID patient, and certainly for the entire year of serving COVID patients. As we look back over the past year, we can certainly appreciate the steady leadership by Governor Hutchinson. Thank you so much for your steady leadership. We've been through some stressful times, and we can always depend upon the governor making a well thought out, correct decision. Our Secretaries of Health, Drs. Smith and Romero, have provided significant and correct guidance as we have tackled every new and previously unknown issue we have faced. It has been mentioned, and I'll say it again, the true heroes of the last year are the healthcare workers who have made great sacrifices and worked long hours to ensure outstanding patient care. They have faced stress and adversity at every turn and continued to care for patients at the highest level. So thank you. As Brian and his team have done outstanding work, I wanted to recognize the great work from our hospitals across the state. From day one, they have continually asked, what can we do? Our hospitals not only organized individually, but set up daily and weekly meetings to share experiences and resources with hospitals in the same cities and regions. This communication was instrumental in balancing the load of COVID patients. When we look back at significant challenges, we can see where hospitals stepped up to meet these challenges. Hospitals agreed to stop non-emergent services to preserve PPE. They set up testing sites across our state when we needed to increase capacity. They worked to provide appropriate staffing when the surge was at its peak and we were stretched very thin on the availability of healthcare workers. When we were anticipating the greatest surge of patients in mid-January, our hospitals increased ICU bed capacity by 19%. And when we needed to begin administering the vaccine, our hospitals set up and continue to operate mass clinics to get the vaccine into arms as quickly as possible. Our hospitals have not only asked, what can we do, but now they're asking, what can we do now to help? Having a hospital in your city or county should not be taken for granted, and I would dare say that after this pandemic, they will be continually acknowledged for their persistent ability to solve problems that we had not identified a year ago. We're proud of the outstanding efforts of our healthcare system and extremely proud of our hospitals during this time. Thank you.
From the Office of the Mayor, on behalf of the City of Pine Bluff, Arkansas, and all of its citizens, I present to you a proclamation in honor of the COVID-19 Day of Remembrance. Whereas the coronavirus pandemic is a global crisis that has impacted almost every community around the world, and the first presumptive positive COVID-19 case in the state of Arkansas being reported right here in Pine Bluff at Jefferson Regional on March 11, 2020. And whereas in Arkansas, in the year since, more than 250,000 cases of COVID-19 have been reported, and more than 4,000 have perished as a result of the virus, including Pine Bluff residents. And whereas, whether friends, family, neighbors, or outstanding colleagues, the lives that we have lost were beloved members of our community who greatly enriched the lives of our city. And whereas the contributions they impact will never be forgotten, and their legacies will continue to enrich the lives of all of those who remember and love them. And whereas we are united in gratitude for the courageous health workers on the front lines of this pandemic, and as they provide that support, compassion, and incredible service to those affected by this virus. And whereas the city appreciates daily the Arkansas Health Department as well as our Governor, Asa Hutchinson, in keeping communities updated on COVID-19 through daily press conferences during the initial phases of this pandemic. And whereas the pandemic has forever changed our lives. But we will endure this crisis together as communities united. As we persist through this new normal and hope for better days. Now be it resolved. The city offers this resolution with great sympathy for the lives lost to COVID-19 in Pine Bluff, the state of Arkansas, across the nation, and throughout the world. Therefore, I, Shirley Moorhead Washington, Mayor of the city of Pine Bluff, Arkansas, proclaim that Thursday, March 11th, 2020, shall be known as COVID-19 Day of Remembrance in the city of Pine Bluff, and I urge all citizens to reflect on those who have lost and remember the lasting influence that they have had on our community. Thank you.
Good afternoon. My name is Kathleen Bottoms, and I am a registered nurse and the manager of oncology practice in the infusion center here at Jefferson Regional. I have worked at Jefferson Regional for 9 years. I am also a COVID-19 survivor. This has been an unbelievably tough year for all of us, but after seeing the pandemic as both as a caregiver and a patient, I have never been more proud to represent our hospital and all others who contracted the virus and recovered. As part of our observance today, I'd like to share a poem by Laura Kelly Fanucci that beautifully reflects overcoming such a life-changing experience, followed by a video that gives you a glimpse into the last year at Jefferson Regional. When this is over, may we never again take for granted a handshake with a stranger, full shelves at the store, conversations with neighbors, a crowded theater, Friday night out, a taste of communion, a routine checkup, the school rush each morning, coffee with a friend, the stadium roaring, each deep breath, a boring Tuesday, life itself. When this ends, may we find that we have become more like the people we wanted to be, we were called to be, we hoped to be. And may we stay the way, better for each other because of the worst.
Man, it feels good because about, you look at TV every day, and you see people, they don't make it. It took me about 3.5 months to recover to get where I need to be.
It was nights I couldn't sleep, nights I got phone calls saying they didn't think he was gonna make it. 3.5 months without seeing your spouse or your family member, and then you got kids at home.
Good afternoon. My name is Linda Richardson. I am a registered nurse and the manager of the operating room here at Jefferson Regional. One of the best parts of my job during the pandemic has been seeing patients like Kathleen Bottoms regain their health and go back to their daily lives after battling the virus. Sadly, not all patients are fortunate enough to achieve that happy ending. As Mr. Thomas mentioned, 135 Jefferson Regional patients died from COVID-19 this last year. Some of them were people we knew personally and were dear friends and colleagues, like Lois Merrill, who worked in outpatient surgery at the Jefferson Professional Center. Lois was a great employee, and like so many others, she was with us one day and gone a few days later. As you look around the room, you may notice all the daisies. There are actually 135 daisy stems to represent each person we lost to COVID-19 over the past year here at Jefferson Regional. Thank you.
Hello, everyone. My name is Robin Petty, and I'm a registered nurse and the manager to Center East, one of Jefferson Regional's designated COVID units. The entire hospital was consumed by this virus in 2020, but on my unit, we lived it intensely all day, every day. PPE, constant monitoring of patients' conditions, the possibility of contamination. These things were always front and center of our minds every moment of every day. Our hearts were often as heavy as our physical load, as we did our very best to bring our patients through this unknown territory. We became accustomed to having abrasions on our face from the mask and the shields that we wore. We worked when we were needed, not worrying so much about that schedule we had once so stringently followed. We suffered with our patients and their family members as they longed to be with their loved ones during, for some, the most difficult times of their lives. Some of us even got sick. There were a few that were even hospitalized. And then they came back to work just as soon as they were physically able to and safe for all. And you know what? We would do it all again, in a heartbeat, if necessary. It's why we are healthcare providers, and why we show up for the hard stuff over and over again. I'm proud to be a nurse and an employee of Jefferson Regional, and it's been a privilege that the Lord has allowed and blessed me to be able to share it with such a wonderful group of people that I love and respect. You'll see a little of just what I've been talking about here in a video, which has been created by a very talented man of our marketing department, Glenn Crane.
I hope you see what kind of pride we have in our organization here, but fantastic job to communications and marketing for that fantastic video, or both of those videos. And guys, privileged to work with you and serve with your team as your leader. I'm so grateful for you. I want to thank the governor for being here today. We appreciate your leadership. I hope history will tell the story of how you and your teams have dedicated yourselves to getting us through a very tough year. And personally, here at our hospital, we appreciate everything you guys have done. Mayor, for you and your leadership in the city, and other leaders and the officials that have been helping to make sure people are wearing masks. I think that's been a fantastic thing for our community. I want to thank Bo Ryle. Most people don't know what support we get from our hospital association here, but that leadership team is just unbelievable. We made the second call that I made that morning was to his office, and they were here within just a matter of an hour. So we won't be forgetting that, by the way. I want to especially thank our team members. We've got so many people here that care so much about this organization. Our physicians, just completely dedicated. Just so thankful to be a part of the group. Mr. Black, you're always going to be a member of our family here, and if I can ever help you in any way, you call me. All right. Thank you guys for being a part of this today, and we appreciate you being here. Thank you.
Your comments were fantastic. Thank you for sharing that. Yeah.
shake your hand.
We got 5 minutes. 5
Hey, can you get thumbs up right here?
Can you turn your microphone off? My stuff ain't working.
Yes, sir.
All right. Just put this in your pocket. I'm gonna do a little cheat code today. Okay. So I did a little smart one. Just like your name. Okay. You just look at me. You just look me in the barbershop.
Can you mic? Let's put this one in your pocket.
All right, y'all make it quick.
In your pocket.
Okay.
What does today mean like to you? What does today mean to you?
Man, it's been a great day, you know. All the people showing love, you know, it's a very special day.
And when you watch the video, the tribute video, it's one thing to actually, record it, but then like when you watch it yourself, what did that moment feel like?
It brings back a lot of memories, man. There's a lot of feelings, you know, inside. Kind of almost had me kind of sharing a little tear a little bit, you know. It's been a rough road.
I know everyone's been wondering, like, what that 3.5 months that you've been, recovering, and to be the first patient to be much in this position. What do you want the state to know?
Man, I want the state to know, everybody need to take this serious, you know. It can be your mama, your brother, your father, anybody. You know, just take it serious. Wash your hands, keep your social distance. Don't get too comfortable. Because like I say, it can happen to anybody.
Was there ever a moment, Mr. Black, where you thought, man, I don't know if I'm going to make it?
Yeah, I felt like that a couple of times, you know. I feel like that, but, you know, I was sitting in my bed one night, you know, I had called my pastor. I couldn't even talk. And some kind of way, I couldn't holler dial the phone, but anyway, the phone dialed my pastor. And I kind of made a little noise. He hung up the first time. Then the second time, like I said, I couldn't talk. He just started, him, Sister Wright and Pastor Wright, they started praying for me.
And what does it mean to have your wife, and your kids kind of just, at your side as much as they could, even though they couldn't physically be here during your recovery?
And it's great to have, they did a lot for me, you know what I'm saying? It was fantastic. They did a great job, especially my wife.
Talk about your wife, because she's been through a lot, during the recovery process, even whenever you came out April 24th. Talk about what that day meant like, not just for her, but also for you as well.
Man, it was a very special day. This is the thing I teach, because I do a mentor, I do football. I always teach the kids, never give up. So when I came home, they did a lot for me. It was a very special day. The day they told me I was getting out, I didn't get out, and it kind of upset me, but it kind of upset her too. But it was a great feeling when I came home.
The years gone by, how does it feel to be home? Because not everyone had that opportunity.
It feels great to be home. It's great. The thing you used to do, you can't do no more. I still have little problems. Still get tired kind of fast. I have problems with breathing sometimes, but I just take day for granted. Because it can happen to anybody.
I guess how would you summarize your experience here?
Oh man, it was a lovely staff. They took care of me very good. I wouldn't have had it no other way. They did a fantastic job. The whole entire staff. They took care real good. The rehab, rehabilitation, they did real good.
What do you say to the staff here who helped you throughout this entire time? What do you say to them?
I would love to say thank you. You know, whatever. I probably wouldn't be here for them to hear today. You know, they did a great job. They waited on me. I mean, I couldn't talk. I heard certain nurses can understand me what I was saying with my hand language. They did great.
Thank you so much.
All right. Yes, ma'am. I'm fine.
Thank you, sir. Grab it up the back.
Thank you, baby. You had another friend on that film over there.
Oh, you're fine. So I'm not gonna put the camera on you, but they'll be able to hear our voices. Is that okay? Is that okay? It's okay. I won't put the camera on us, but just as a mother, as a mother, were there days that you think that you would never see your son again?
Yes, there was days I thought I wasn't gonna see him no more. I remember when the doctor said we almost lost him 3 times. But praying, we were some praying people, and I still ask people, still pray for the world and everybody, because it's no joke. And I was stressed real bad and stuff. When he wanted to see my face, I would let him see my face on the phone, and then I'd walk away, cry, and start praying.
Tell me about how it was when you got the phone call that he could come home.
I was happy, very happy. And when they said I could see him, I was going to see him until he came home and everything.
So what has it been like since he's been home? I know it's been a...
Joyful. He always called me, old woman, what you doing? What you doing? I said, nothing, sitting up and watching television. What you doing? Nothing. I be over there after a while. I said, okay, what you done cook? I said, nothing.
Just tell me about, the journey overall, and what you're most thankful for, and what would you tell other people during this pandemic, especially as we're getting more lax with the rules and regulations.
Be careful, still wash your hand, do your distance, and don't get too comfortable because it's not over yet. It's just easing up a little bit, but it's not over with.
And again, this is the mother of James Black, and if you could say your first and last name for me.
Lily Black, and pray for everybody, because it's not easy at all. It's most stressful, but just keep on praying, because God got you here for a reason, and God didn't keep him for a reason. So just pray.
Well, thank you everybody for joining me. This is E with the Pine Bluff Commercial as we remember this day 1 year ago. And for those who have lost a loved one, we most certainly, our condolences are for you also as we continue to journey on during this pandemic. Again, thank you for joining. This is E with the Pine Bluff Commercial. Goodbye.